You done? Well, so it is my pleasure to introduce one of our FCT colleagues, Steve Tonziger. He practices in Wisconsin. His background is biochemistry, toxicology, and traditional Chinese medicine. So he would like to share some of his experience. Likewise, as Ken Andis, he's been combining Chinese medicine with the FCT. Okay, thank you. Sure.
It's hard to follow Dr. Yurkovsky. It reminds me of when I go out with a very good friend of mine. He's a professional singer and actor, and for fun he likes to go out to karaoke bars and sing. And I'm a good singer actually, but it's pretty hard to stand up and sing after my friend gets up and wows everybody. Then you stand up and you go, all right, well, okay, I'll sing. And I'm kind of depressed because my wonderful wife, Ardith, keeps telling me about block number 15, which, if you recall, has to do with sharing fluids in the mouth. And I just want to tease her because I have to sleep on the other bed now because I think my insights are related to my mercury and my parasites maybe. So my software for doing this comes from my work in biochemistry and toxicology and Chinese medicine, and then some other dabbling and work with laser that we were talking about earlier. And I started looking at FCT about 4 years ago, and I've practiced FCT for about 3 years. And I did some statistics a month or so ago because I dream about vials now, and I dream about patients and remedies, so I know I'm crazy. But I've done about 4,000 tests and made about 30,000 of these little brown vials. And so it's built my software up, and for example, it's just kind of fun to hear you talk, and I realize I'm not the only one who's been using 10MM 60 or 90 or 120. So I'd still like to know more about how that works, why my software wants to use these higher potencies and how powerful they are. But I have great results with people. I work too much. I love the work that I do. For those that just got their certificates, I feel like I want to be preachy, but only in the sense of saying that your software for doing this grows with each person you treat. And each week that I'm in the clinic, I learn something new. And so I'm intrigued with all the things that were said, and I'm thinking about Ken's presentation, and now I have more things to think about. But I think about it more and more in terms of the relationships between organs and pathogens, and I could spin all kinds of wonderful, interesting theories. It makes for a good dream life about how all of this works, and so it's fun to talk with Jonathan, for example, about how he organizes this all together, and I do the same sort of thing. One part of that I know some of you do know about this book, but I've had the privilege of meeting Dr. Tiller, and we're going to do something together about some of the work I'm going to mention. And I mentioned it to Simon too, because I think at least there's a